Hi, are you at risk for heart problems? I hope not. But anyway, this is Cindy Talley, and I'm with Aging Joyfully with Cindy Talley RN here on this site and also on YouTube and Instagram. And I hope that if you find this information interesting, that you will please subscribe to my channel. I would love that. So anyway, the other day I talked about on part 1 on cardiovascular disease and are you at risk? Because if you're a woman over 50, nearly half of all problems and deaths are caused from some type of cardiovascular problem. And then on part 2, I talked about blood pressure and what is it. And so today, part 3, get this right, part 3, I'm going to be talking about some of the problems that high blood pressure can cause. So what are some of the problems? If you have a long-term high blood pressure and it goes undiagnosed for a long time, can definitely start developing issues. It can affect your organs, not only your heart, but your eyes, your other organs like your kidneys, your brain definitely. So increasing with your blood pressure over time makes your arteries less elastic. Like they should be kind of pliable and movable, but they become stiff. And you've probably heard of hardening of the arteries. That makes it harder for that blood flow. It has to pound to try to get through those arteries, and it starts to break off little pieces of that, which then causes like heart attacks and strokes. So one of the first things I want to talk about, when you have a decrease in your blood flow and the oxygenation, you can cause your heart muscle to ache, and that is called angina. And that is not good if you have chest pains. Number 2, a heart attack. If you have one of those little pieces break off, causes a blockage in your heart. That little part of that heart muscle starts to die and you are having a heart attack. And so if you're just having chest pains, it could be angina, but you don't know. So if you ever have chest pains, 911, you need to get there and get it checked out, because a heart attack is serious and you can die from that. Another problem it can cause is strokes. A stroke is when you have when the arteries that supply the blood and oxygen to the brain either burst or it blocks. And that's called a stroke. And you can have it long-term, like speech problems, mobility problems, or if it's just a small stroke, it's called a TIA, and that will usually recover everything within 24 hours. Hopefully you'll be back. But then that's a warning sign to a future potential larger stroke. But a stroke can kill you, so definitely that's serious. And number 3 can cause kidney disease. Chronic kidney failure, chronic kidney disease can be caused from high blood pressure. All right, get your blood pressure checked today and get it under control. All right, God bless everybody. Take care. I'll talk to you later.